around at the town hall meeting one day. I saw a lady there who had gray hair stand up and have a thing or two to say. She told her congressman that she didn't understand why the country was heading for a wreck. Seems the government solution is to burn the Constitution and to put her grandchildren into debt. I know the government is taking my retirement to pay back the red Chinese. And now they want to try to tell me when to die with the cash for a clunker subsidy. The cash for a clunker subsidy.
What group are you guys from? Oh, okay. You want to sign? Nope.
That's Soros.
Checking. Hi, my name is Holly, and I am pregnant, 7 months pregnant about. I'm here to support the people here who are here to support our freedom, not to have government health care inflicted upon us and imposed upon us. I'm 7 months pregnant right now, getting ready to have my first child, and I'm trying to protect her rights as well as those of mine and my husband and all my fellow citizens to have the choice and not to be forced under a government health care plan. One of the things I've heard, though, is I have heard people saying, for example, Ezekiel Emanuel, who's one of the healthcare advisors, he's actually talked about the government making decisions about what will and will not be available to patients. So how is that not similar to what the problems are you're explaining?
Who is he?
He's one of Obama's healthcare advisors.
He took care of
No,
his brother. His brother.
Yeah.
Yeah.
Yeah, but you know,
He's his advisor.
I hear him too. He may be an advisor,
I do.
but watch the way he carries. And listen to people in Congress. The people you should be listening to are Waxman.
Well, no, what I should be doing is actually reading the bill, which is what I've done. Because people can say anything, but I've read what's in writing in the bill, and there are a lot of restrictions and a lot of problems, a lot of prohibitions on freedoms that people would have to get certain care, and restrictions on people's private care so they won't have the choice.
But that's 3,200.
Yeah, and that's what's being voted on. That's why we're all here.
No. There are two other committees that haven't submitted anything yet.
Yeah, but we're here talking about House Bill 3200 because he is our congressional representative in the House. That's the bill he's voting on. So that's why I'm here to say don't vote on that.
No. He can't vote on 3,200. He's probably going to be the most powerful voice in the whole mishmash. But Waxman is pretty powerful. So
who's powerful? To be honest with you, who's powerful are the people that are here. The senators themselves are not powerful in the way that you're saying. He may have a loud voice. He may get on the media more. He may be on the right committee or whatever.
He's chairman.
He might be the chairman of the committee, fine. But he is subject to the people. That's why we're all here. And the thing that I don't understand is that it sounds like you're putting a lot of faith and trust that the government will get it right. But once the government has their hands in it, what if they don't get it right? We can't get it back. The thing is, with the insurance companies now, we have a choice. We could go from one to the other, or like the $50 test you were discussing, they could have actually chosen to pay for the $50 test. I had a medical procedure to do with my pregnancy that I chose to go outside of my insurance and pay for. But if the government gets its hands in it, if indeed they are not trustworthy, and if they don't get it right, then we have no more recourse. What do? We have to trust them blindly and say, I hope they get it right. I hope they don't put a restriction. I hope they don't ration care. I hope they don't give it between me and my doctor. But what if they do?
Well, most doctors
question. Why do we trust the politicians? What track record do they have that they'll get it right? They're not even in medicine. They're not even doctors. They
I'd
don't
rather
even
have the
understand
doctors
system.
making these choices, not government, for goodness sake. Yeah, the doctors should be
We're all
doing
being
it.
asked to
That's
blindly
all,
trust
yeah.
that the politicians will give us that right plan.
But what
Yeah.
you need to make sure is that the doctor-patient relationship. You know this old saying, the opera isn't over till the fat lady sings.
Yeah.
Well, thank you for sharing that. I appreciate that.
Nurses are feeling the same thing. You've got a nursing shortage of 500,000. You've got a shortage of family practitioners, and you've got a shortage of pediatricians.
You know what? That's one of the concerns I have as well. Right now we're saying there's 47 million, give or take, people without insurance. So the question I have is, if we already have a shortage of doctors and we add those 47 million people onto healthcare insurance, who's going to treat them? And that question has gone unanswered.
I went down to take a look around at the town hall meeting one day. I saw a lady there who had gray hair stand up and have a thing or two to say. She told her congressman that she didn't understand why the country was heading for a wreck. Seems the government solution is to burn the Constitution and to put her grandchildren into debt. I know the government is taking my retirement to pay back the red Chinese. And now they want to try to tell me when to die with the cash for a clunker subsidy. The cash for a clunker